be able to read it, but I will point out what it says. In summary, basically, and I would like to ask Megha at the end to comment. This is a question kind of a thing. Here is a study that was done in 2012, almost 4 years ago, in Children's Hospital. Dr. Corbett is well known, located in Ottawa at that time. Observation in Children's Hospital is frightening. I think that's what I want to point out. You notice that the lots of children are fat, obese. You heard the definition today. And then they have diabetes. Now type 1 diabetes in children, you hear about it. But type 2 diabetes in children at one time was unheard of it. So there is type 2 diabetes. The blood pressure was marginally up, and also the cholesterol was out of line. Now that was the observation at that time, and you heard today these are all features of metabolic syndrome. And my question to you, Megha, is how serious this problem is, because he pointed out his concern that it's not only what we notice, their fat, and their diabetics, their blood pressure and so on, but what is concerning is the last part. Their blood vessel, they looked at their eyes. If you look at the eyes, you can see the blood vessel in each one of us. And that will tell you the status of your blood vessel all over. So they notice that the blood vessel in the eye, in that situation, under the age of 20, the blood vessel is like the age of 40. Now, would you keep that in mind? The blood vessel at the age of 40, now you are seeing in a person who is 20. And you hear all the time that, oh, there's a heart attack in 30 and a stroke in 30. Well, don't be surprised. There's a reason for it. So my question to you, Megha, is how serious is this problem? Like to come over?
Sure. So, I mean, I agree. I think the problem is very, very serious. We're seeing childhood obesity rates climb exponentially in the last 5 to 10 years. I think there is a big problem with treating weight. So it is much easier to prevent a lot of problems than it is to treat a lot of problems. So if we're seeing children have high blood pressure, high blood sugars, and high cholesterol, that to me is a very, very scary thing, because we see the complications at an older age, so at the age of 60 or 70, and we often, start medications and we try our best to control the complication and the problem. But when we have it in children, it's a completely different issue, because they have 50, 60, 70 years of living with the complications of a lot of these diseases. And the other thing is, I believe it is completely preventable, which for me is the biggest concern, is because this does not need to be the case. It is preventable. So I think it's education, it's taking sugar out of the schools and doing a lot of the things that you're hearing in the news now to try and prevent dealing with the complications of children living with these diseases for their lives.
I did not put it here, please stay.
Yep.
I did not put it on the slide. They studied their diet in these kids. The striking thing was drinking soft drinks, loaded with sugar, whether it's Coke or Pepsi or anything else. Second thing is pizza. And the third thing, of course, going to these McDonald's.
Fast food.
Fast food. That were three things they pointed out. And they said this is a big concern for the future. So that was one question. You mentioned about all these points, cluster of conditions. Could you comment on insulin resistance? Because South Asians, you and I, are particularly prone to insulin resistance. That means you take sugar in any form and shape, most likely Indian sweets, and your blood sugar goes up. How come your body cannot handle it? Would you like to comment?
Sure. So insulin resistance is an issue related to fat tissue at the end of the day, as well as long-standing poor blood sugar control. So insulin is a hormone that's made in an organ in our abdomen called the pancreas. And every time you eat a little bit of sugar, the pancreas releases some insulin into the body to bring the sugar down. The more that you eat sugar, the more insulin is released from the pancreas. But eventually, after years and years and years of high sugar, the pancreas burns out and isn't actually able to make as much insulin, and the insulin isn't as strong. So insulin resistance means that your body has to make 2, 3, 4 times the amount of insulin to control the blood sugars the same way it would with somebody who doesn't have insulin resistance. And this is really when you see people spilling into the diabetes range in their blood sugars. So oftentimes when you're pre-diabetes or have borderline diabetes, your insulin resistance is on the way, but it's not all the way fully into the insulin resistance phase. But when your insulin becomes completely resistant, it's basically weak and you need more of it to control your blood sugars. Oftentimes that's when you'll see that you're in the diabetes range. Also, fat tissue is something that's directly related to insulin resistance. So you can improve insulin resistance by actually reducing the weight and getting rid of fat tissue.
Why the South Asians are more prone to insulin resistance?
So it is a genetic trait, absolutely. So like I mentioned, the waist circumference. So South Asians tend to have higher amounts of insulin resistance at lower waist circumferences. So there is a genetic predisposition to it. Some of our foods tend to be higher in carbohydrates and higher in sugar. So some of it is lifestyle as well. And then there are other sort of traits from a genetics, cultural component that puts South Asians into higher risks.
Metabolic syndrome, we heard it. Nice consequences are frightening. You mentioned about the heart and stroke. How many people suffer from sleep apnea? We talked about this in this hall many times. It's a big issue. Now there is more and more evidence that cancer may be a complication of that. Would you like to comment on that?
Yeah, so sleep apnea is directly related to obesity. So a BMI over 30 has a very high incidence of sleep apnea. And as you know, that's low oxygen levels throughout the night that puts strain on your heart and cause you to have difficult to control high blood pressure. So it's something that's actually not well diagnosed because we don't often ask about it, so important to think about. And then the cancer theory is, it's still, I believe, a hypothesis. There has been many studies to show patients who are overweight or have obesity have higher rates of certain cancers. Specifically, colon cancer would be one of the main ones. But they haven't necessarily been able to show that the two are correlated in terms of treatment. So if you were able to lose a significant amount of weight, does that really change your cancer risk? That's, I think, still a question mark and still undergoing research. But there has been shown a correlation between obesity and cancer risk.
Is there any correlation between Alzheimer's and obesity? That's
Yeah.
talked about more and more. Any comments?
Yeah, so I think it's still something that's seen in some studies. I personally think that there is probably a correlation between obesity and earlier diagnosis of Alzheimer's. But it tends to be a lifestyle issue. So people that tend to have obesity are people that have poor dietary habits and potentially smoking and less activity. And so we know those things are related to Alzheimer's. So whether it's the weight alone versus some of the other habits that are surrounding weight, I think that's still to be said. But there are studies that do show a correlation between the two.
How does it start, the metabolic syndrome, in anybody? How much the genetics play a role? Any comments?
So there are various genes, especially from a weight perspective, that have been isolated to show that there are certain centers, for example, in the brain that control when you feel hungry and when you feel full. So if there is a genetic problem in that center, that gene in that area of the brain, you are predisposed to having obesity and a lot of the obesity consequences. So we are learning more and more about the genetics related to weight, and it's playing a bigger role in our treatment options from a weight perspective. So I do think that we're going to learn a lot more about this area in the next 10 years, but it's an important thing to know about. Yeah, there's a question.
Oh, sorry, wait, just a moment, please. Gender.
Yes, so gender absolutely plays a role. Oftentimes it depends on what group you're speaking of, but women tend to be at higher risk than men. And that has a lot to do also with hormones, so estrogen versus testosterone. Estrogen tends to be more related to a fat component versus testosterone, which helps with muscle building. So there is a somewhat predisposition for women to have a higher weight than men and suffer from a few more complications from weight than men.
Ethnicity.
Yeah, so that one we definitely talked about. So I think the South Asian population, Native American population, there are definitely subgroups that are at higher risk of metabolic syndrome.
You mentioned about the age. The syndrome increases with the age. We talked about the concern in children.
Yes.
And the last part that you mentioned, the lifestyle. Which one out of these you think is the most important one?
I'm biased. I'm going to say lifestyle, absolutely,
of course.
but I'm biased.
Okay, now, this is the Framingham data. Now, you know, about 2 weeks ago, 3 weeks ago, we had a health clinic here. Heart and Stroke Foundation of Canada. They came and did the health study. And what basically they did was what Framingham, this is a suburb of Boston, the biggest epidemiological center in the world, where all these studies are done. And in 2009, they came up with this cardiovascular risk factor, 10-year risk. If I do the analysis today on me, I can predict in 10 years what is my risk of heart and stroke. So that is what we did in this temple about 3 weeks ago. And the age, gender, we did here cholesterol, we checked the smoking history, we checked the diabetes, we did measure the blood pressure, and so we did this analysis here. We are going to circulate this information electronically to whoever is on our mailing list with some certain recommendations that they should go and complete this form and assess their own cardiovascular risk factor. Now, before I open for discussion, I just want to mention next month the seminar that we have on a regular time, second Sunday, is on food safety. We talked about safe food today, those who consume meat, they should be aware of the use of antibiotics in animals. Why do they use antibiotics in the animals and then they prepare the meat? What are the consequences of use of antibiotics in animals? Same is the growth hormone in animals and what they feed the animal. All of this put together, the effect of the meat, and if we consume, what are the implications? If those who are vegetarian crops of any kind, you heard so much today, organic and non-organic, use of pesticide, you have seen epidemics, not endemic problems in certain areas, and the genetically modified food, what are the implications in our daily health? So this is the seminar for next month, and I think this is a very important topic. When I mention others, issues related to food safety, Megha talked about today, and I just said 2 words on that. It's not a question of size of plate only. Eat less. Eat less and move more. You can't go wrong. If you eat less and move more, you can't go wrong. So we have almost 15 minutes for question answers. You had a question at the back, please.
Insulin हिंदी में क्या है? What is insulin? How do you translate in Hindi? What is in Hindi insulin?
He's asking, how do you explain in Hindi insulin resistance? Oh, okay, I'll try it. I'll try it. Just bear with me.
This is not my question. My question is, how do you translate? उसका हिंदी में क्या शब्द है इंसुलिन को क्या कहते हैं हिंदी में?
Any other question?
Yes, I have two more actually.
Okay, excuse me. Go ahead.
दूसरा सवाल है जो स्लीप एपनिया है. Sleep apnea can be cured by Anulom-Vilom and breathing exercises.
That's your comment.
Sleep, that's my comment and experience too.
Good.
It could be controlled, completely finished by Anulom-Vilom and by breathing exercises.
Lot more to it.
Okay, excuse me,
There's only
please.
one comment.
Hello, please go ahead.
एक तीसरा सवाल है, वो तो मुझे इतना जरूरी नहीं है. पुदीने का चूरन जो है इसमें क्या असर करता है? इंसुलिन को ये कुछ बढ़ाता है, घटाता है?
Okay. Let me talk a little bit in English. Insulin resistance, he wants to know what do we say in Hindi. I don't think we should need to spend time on it.
I agree.
And secondly, sleep apnea can be cured by maneuvers. I wish we can try this, make trials of this, and prove. We talked about here evidence. Now you remember we had a seminar on evidence. There are 2 kinds of studies. One is observation study. You do it, you think it is right. But if you do the same thing in a randomized way, instead of observation, now it's randomized. That means you have taken 200 people on this side and 200 people on this side. To this person, you give the treatment that you think it is good. To the other side, in the same shape and form, you give a placebo. That's randomized. We don't do that. Unless we do randomized studies, the evidence is not strong. Observation studies are good, and I think so long as they don't do any harm, we keep on doing it. Next question. Go ahead.
How important it is to know Alzheimer earlier? Can it be, can we do something about it?
Okay, we talked about Alzheimer in these seminars twice. And once Alzheimer is diagnosed, there are 3 forms, and the bottom line is not much you can do once it's diagnosed. The Canadian guidelines published just last year, how do we screen people, those who are at risk? What are the risks for Alzheimer? And they went over the list. There's only one recognized indication. If somebody in the family have an Alzheimer, first relative, those are the only people who should be screened for Alzheimer, not otherwise. So I can give you those information, you could look at it. Go ahead, Harry.
I was wondering with insulin resistance and people with blood readings of their glucose over 7, they're put on metformin. What is the mechanism for metformin as far as this type 2 diabetes is concerned?
Ingredients of that.
So metformin basically works on the liver, and the way it works is by changing the way that your blood sugars are stored, so that blood sugars are stored in the liver in the form of glycogen. So it doesn't allow the blood sugars to be broken down as well. And it also works right on the insulin receptor to improve insulin resistance. So this is why metformin is always the first choice to start anyone on for diabetes, because we really want to try and improve insulin resistance right away, but also control the blood sugars. So that's how metformin works.
You sure?
Yeah, I was going to say, I want to thank you for the great seminar here. Sleep apnea, I suffer from it. I can speak from my own doctors and experiences that weight reduction was the key, I was pointed out, and I'm improving. I've lost 10 pounds. I do exercise daily, and I'm trying to control my diet a little bit. So I think with that, I can say I'm a living example. But these other things are also not harmful. I'm not going to cut you down. It's yoga and all that stuff. So I'm one of those guys who suffer, but it's not you can improve it, you can control it, and good suggestion.
Any other questions? Please go ahead. Could you say,
I want to ask you about the hormonal effect, the whole topic you said. How does it affect the hormones in your body?
Which, you mean just hormones in general?
Yeah, like somebody has a more active, because their hormones, they are always higher, like they are active and some are not active because of hormonal.
Okay. So I don't know if I understand your question well, but are you referring to metabolism?
Yes.
Okay. So there are many, many, many hormones related to metabolism that help regulate our body. So hormones are protein released by organs that help keep our body in a normal, steady state. The most common hormone that you're probably thinking of is the thyroid hormone. So the thyroid hormone is a hormone that's released by a gland that sits in the front of the neck. That is important in every single cell in the body to keep the cell running at a normal, steady state. So if your body is making too much thyroid hormone, everything is increased. So your metabolism is sped up, your bowels are running faster, your heart is pumping faster. If your body is making too little thyroid hormone, the opposite is happening. Your metabolism is slowing down, which means that your body is burning less calories at rest. Your heart rate is slowing down, you're fatigued, you're tired. These are all symptoms of an underactive thyroid. So when you're thinking about metabolism, the thyroid gland is usually the most common, but there are actually many hormones related. So there's the growth hormone, there's a cortisol hormone. The body is a very intricate system that works all together. But oftentimes, if you're worried about a metabolism or a thyroid issue, there's a blood test that your family doctor can do to help determine whether it's normal or not.
Go ahead.
I want to ask you, like, if a person
Louder.
wants to lose weight, you all think about diet and exercise, layperson's viewpoint. Do they really have to go for a full, investigation by a doctor, concerning what you said just now about hormones and everything, then, launch that effort? Or some people, you lose weight easily, some people, regardless of whatever they do, they don't lose weight.
Yeah.
So I just want some insight on.
Yeah, so first, before you're changing what you're doing dramatically, especially if you're on medications. So, for example, if you are being very physically active, but prior to that you weren't being physically active at all, this could stress your heart out too much. You could be on medications to lower your blood sugars and cause yourself to have a low blood sugar. This is why I think that no matter what, a simple conversation with your family doctor to say, I encourage you to be active, you have no barriers, you don't need to change your medication or be worried, is a simple and important conversation to have just to be safe. I think that weight management is a very difficult issue for a lot of different people. Everybody is different. But the first step that I always say is know what you're eating, know what you're putting into your body. If you can pick less quantity, that's the easiest step to start off with. And then work to try and pick better choices within that small quantity. I think that most people need help. It's not easy to do on your own. I think dietitians are a great resource to use to help pick better choices, and there are great online resources as well that can help sort of guide you and make a meal plan that helps you really make sure you're hitting your targets.
Yes, please.
Related to food, you said Subway example was 660 calories, but it got 20 grams of protein.
Right.
Versus 404 calories of dosa. So, if is it still better to have
Right.
Subway?
Yeah, so the fat content is the reason I don't think it's a good idea to have the Subway.
Okay.
So that's why I personally think if you can look at the calories and look at the protein, those are the two easiest targets to start off with. So the lowest calorie foods with the highest protein are the best options. And then worry about all the other stuff, the fats and the carbohydrates afterwards. Otherwise, it's too difficult. So I think the easiest thing is look at the calories and look at the protein.
Protein.
Yeah.
You heard 70 grams of protein for most of us, assuming we are about 70 kilograms. Now, I know people, he's not here today, in the audience, that person is consuming 300 grams of protein per day. Now, any one of you, are you familiar with the problems with the high protein diet?
Yeah.
Yeah.
Kidneys.
Kidney is
Liver.
one.
Yeah.
Any other? Any other? It may come as a surprise.
Fat.
What it causes, you say kidney problem. That's true. Although I can talk about that separately.
Okay.
The biggest concern is if you look at the epidemiological evidence, since 1950, which is almost 70 years coming up, the meat consumption peaked very high, although now it's coming down a bit. What else has gone up with the meat consumption? Heart attack,
Yeah.
weight gain, on and on. Don't forget the cancer. Cancer rate has gone up.